The aged care staffer showed up for 6 consecutive shifts at the Anglicare Newmarch House facility, which is in Caddons in Sydney, and that's despite having some mild symptoms of the disease. The New South Wales Premier Gladys Berejiklian and also the Chief Health Officer Kerry Chant say that the worker is mortified and distraught at the idea that they were the start of the cluster, which has now seen some 15 people infected, and 9 of those are residents of the aged care facilities. The other are staffers there. Now, at the time, the woman had just a scratchy throat and also a sniffly nose, so it does go to show how mild some of the symptoms can be. There has been a renewed focus on testing. Of course, overnight we've only seen 11 new cases in New South Wales, but thankfully we have started to see the testing ramping up again after the Easter break. We had just over 3,000 tests in the past 24 hours, but the hope is that number will continue to rise.
We have capacity to test around 4,500 people every day. We're only at 3,200 today, so please know that if you do have those symptoms in those areas we've identified, please come forward. And if you're someone that's concerned and you work with a lot of people, please come forward. And if you're a vulnerable person with existing conditions, please come forward. We also want to make sure that we identify the source of the virus so that we can really clamp down on any community-to-community transmission, because that is the real threat to us.
In New South Wales, we currently have 2,897 confirmed cases of COVID-19. Around 206 of those are receiving medical treatment. 26 are in ICU and 19 are on ventilators.